Welcome back. Let's recap what our goals are for today. We're about to walk you through how we're going to address the underlying causes of your neuropathy, how we'll rebuild and restore your nerve function while maintaining proper nerve function long term. By now, you may have talked with your practitioner about your condition and how it's affecting your life. If you've made it to this point in our process, our practitioner has probably already talked with you about your condition in detail. You've talked about your neuropathy condition, how it's affecting your life, what your health goals are, and your practitioner has helped you understand the possibility of getting your life back, in addition to the implications if you don't take action with this chronic condition. You already think more like a neuropathy expert than you might think. For example, what would you do if you saw this plant and you wanted to help it heal? Well, you'd probably give it sunlight, water, nutrients, maybe try to clean up the soil, or if it had bugs on it, remove the bugs, give it some better air. Well, guess what? You're exactly right in your thinking. Every living organism needs specific things to live properly, and this is exactly what we're going to be doing to address your neuropathy. Your nerves need very similar things to a plant to survive. So now let's look at this nerve chart right here. On the top, you see a normal nerve. The blood vessels surrounding the nerve are nice and healthy. They're supplying the nerve with nutrients and oxygen that it needs to live. As you can see, the middle nerve has a different look to it. It has some constriction of the blood vessels, which is cutting off its blood flow, decreasing the flow of oxygen and nutrients to the nerve, and this is where symptoms of neuropathy might start to appear. Now, most people really don't start to have symptoms until the end of this process. So if you've had symptoms for some time already, then we need to look at the last nerve on this chart. Here, most of the blood vessels surrounding the nerve are gone. The nerve is completely constricted from blood supply and it's dying off. This is a dangerous stage. This is where you don't want to be. So if the top nerve is healthy because it's getting a proper blood supply, wouldn't it make sense that we want to create new blood vessels and repair the damaged ones so we can restore the proper blood flow to the nerve? Well, this is exactly what we're going to be doing for your condition. We can never get true healing with the drugs, surgeries, and injections approach. That is not the best approach. Those avenues only mask the problems and allow them to get worse. By contrast, we are treating the underlying causes of your condition and giving your body exactly what it needs to heal itself. We restore nerve function and health and healing from the inside out. We take a comprehensive approach to treating peripheral neuropathy, and we see the best outcomes for our patients as a result of addressing the body as a whole. A critical and unique part of our treatment plan involves a series of comprehensive treatments that we've developed to put the body back into an optimal position to heal itself. Your body knows exactly how to heal itself. Sometimes it just needs a little help. Let me give you an analogy. If you were to break your arm and you needed to get a cast, does the cast heal your arm or does your body heal it? Well, of course, your body does the healing. If I were to cut myself and need stitches, do the stitches heal the cut or does my body? Well, of course, it's the body. The cast and the stitches are just putting the body back into the right position to do exactly what it already knows how to do, and that's heal itself. And that's exactly what we're going to do with your neuropathy. We are going to be focusing on 3 components to restore your nerve function. They are 1. Creating a healthy environment for your nerves to heal by eliminating factors that are hindering them from doing so. 2. Increasing blood and stimulation to the nerves, allowing them to gain strength and stability again. And 3. Re-educating the nerves, helping them remember again how to properly function. So, let's dig in. Neuropathy is a condition that requires treatment for all damaged areas. Fortunately, we have developed a 5-part therapy regimen that has shown great results for our patients. By leaving no stone unturned, we are able to guide your health toward normal again. Here's how we do it. Neuropathy needs a comprehensive approach to heal. It cannot be done by taking a medication or an injection. Since there are so many factors that contribute to peripheral neuropathy, a comprehensive approach is needed to treat it. These therapies often include infrared therapy home care, repairing and creating new blood vessels, electrotherapy home care, where we're teaching your nerves how to function properly again, metabolic management education, guiding you through how your metabolic health can contribute to your neuropathy condition, and last but not least, the in-clinic protocol to help with joint care, balance, and overall function. You'll be assigned in-clinic visits by the doctor if he or she feels it's necessary, and your practitioner will also assess how frequently you might need to visit. So what does infrared therapy do for neuropathy? Well, infrared therapy, also known as low-level light therapy, stimulates a process called angiogenesis. Angiogenesis is the naturally occurring creation of new micro blood vessels around damaged areas, allowing them to bring in oxygen and nutrients that the tissue needs to heal. Low-level light therapy stimulates the production of vasoendothelial growth factor, or VEGF, which is a signaling molecule that's responsible for stimulating angiogenesis. Low-level light therapy stimulates VEGF to create angiogenesis. You'll be able to use this technology in the comfort of your own home to ensure that you're receiving the treatment you need. Let's dig a little deeper into the benefits of this technology.
Nerves, most commonly in the extremities, sense this lack of ATP production by sending pain signals to the brain. In some cases, a lack of sensation rather than pain is the chief symptom, and this is the main reason for falls. Because the mitochondria are very sensitive to light, infrared light therapy can stimulate ATP production in the mitochondria. That is, if the nerves receive glucose and oxygen through increased blood flow to the nerves. Light energy stimulates the release of nitric oxide from hemoglobin into the bloodstream. When nitric oxide is released from hemoglobin, it enters the muscle cells in walls of the blood vessels. Muscle cells relax as the blood vessel diameter enlarges, allowing more blood to flow through the vessels. Increasing nitric oxide levels in the body offers a host of benefits. These can include anti-inflammation. Inflammation occurs when oxygen levels are too low, so increasing blood flow via nitric oxide reduces inflammation. Tissue regeneration. Tissues that need to heal require oxygen, nutrients, ATP, and growth factors. Nitric oxide provides an environment for enhanced healing. The key to accomplishing this? Better blood flow. Pain reduction. Pain occurs when oxygen levels at the nerve are too low. Think of how painful your finger becomes if you wrap a rubber band around it. The rubber band cuts off blood flow, thereby depriving nerves and other cells of oxygen. The pain recedes when the rubber band is removed. Increased localized circulation. Nitric oxide is increased locally when light energy is applied to any specific site. Along with it, blood flow increases at the same point. Light is composed of photons. Photons are quantum units of energy. A photon emitted at a specific wavelength or color contains the same energy irrespective of the source. Light near the blue end of the spectrum penetrates about 2 to 3 millimeters. Light at the red end of the spectrum penetrates about 8 to 10 millimeters. And near-infrared light penetrates about 20 to 100 millimeters. Near-infrared light is more energetic than visible light, less resistant to reflection and absorption, and therefore penetrates soft tissue to a deeper level.
In synergy with your home infrared therapy, our next strategy is going to be re-educating the nerves that are dying off. The device you're going to use for this is going to use electrical impulses to shut off pain signals from your brain and to mimic your nerve impulses, which is almost like a workout for your nerves. This way, it both decreases pain and improves the function of your nerves, allowing them to get stronger. The device we use is a cutting-edge new technology that's been used in the Cancer Treatment Centers of America to treat neuropathy associated with chemotherapy. This is not the same thing as a TENS unit, which you may have seen before. This is a completely different device. You'll be able to use it in the comfort of your own home throughout the program, which allows you even better results, and it saves you time spent in our clinic. You'll be able to use this device while you're reading, watching TV, even if you're traveling. Your practitioner will teach you how to use this easy-to-use device right at home. And best of all, you're going to own this device after the program is complete. We speak the language of your nerves. We use cutting-edge digital electrotherapeutic stimulation to help nerves and joints stop hurting and begin to function properly again. Our low-level light therapy treatment uses healing light and pulsed infrared energy to provide safe, non-invasive relief for nerve pain symptoms. You'll be able to do both of these treatments at home to ensure long-lasting results and set yourself up for long-term independence from your neuropathy condition. Another component we're going to guide you through is the metabolic component. In order for your tissues to fully repair, we have to address the body's internal inflammation levels. We also need to address blood flow to the damaged areas and excess stress on our body's tissues. Your practitioner will choose which protocol is right for you for full recovery. One of our highly researched concepts we add to all our natural programs is behind a Nobel Prize-winning concept, nitric oxide, and your body's overall health. Your body naturally produces nitric oxide, and with the proper levels, it helps the circulation all over your body, including to the hands and feet. Watch this quick video on your body's ability to produce nitric oxide and the benefits it has for your health. Lastly, we'll have home education for you to go through at your own pace. We'll supply you with daily health tips, recipes, if you like to cook, program tips, and more, all for your enjoyment and support. Over the course of 90 days, you will learn how to use the Neuropathy Reversal Protocol. The practitioner you're seeing has invested a lot of time and energy and a lot of training to have this available to you in their office. There are hundreds of locations across the country helping neuropathy sufferers just like you with this program. By using the cutting-edge approaches that we do, you'll have the ability to heal yourself at home while still using synergistic treatments in the clinic. By using this multi-pronged approach, you will get optimal results. Near the end of our program, you're going to be well on your way down a path of health and independence. All of these services are equally important throughout the 90 days you'll be with us. Your practitioner has the best plan of action to address the underlying causes of your neuropathy, and not just cover up the symptoms with drugs, surgeries, and injections. At this point, we'd like to ask you to start thinking about what your motivations are for doing this program. Why is it that you want to get better? Is it that you want to have an easier time sleeping at night? Maybe you don't want to lose your freedoms in life, like going on walks, spending time with your family. Or maybe it's the fear of health complications, like disability or relying on medications just to get through the day or night. Each person is different that comes through our doors, but it's important for us to understand your motivations, because your motivations become our motivations. The doctor will be in shortly to review your recommendations and make sure you're a good fit for our program. Thank you for putting your trust in us with your health. A practitioner will be in to see you shortly. Your practitioner will discover if you're a good candidate for our program and will cover any questions you may have.